Well, you know, I've been a great proponent of exercise. And my mother was always my favorite example because she said to me, David, when I get the urge to exercise, I lie down and I stay there until the urge goes away. And I've also heard every excuse about exercise. I'm too tired, I'm too sick, I'm in too much pain, it's too far, I'm too embarrassed, it's too expensive, I'm too old to exercise. There's this too excuse. So someone comes to see you, they've got back pain. We know that walking is the premier way to improve back pain. How do you get people to exercise, and what kind of exercises do you recommend?
You have to do a lot of education, and you have to be a bit of a cheerleader as a physician to get them to consider the role of exercise. And I have advocated walking for a long time to help with osteoarthritis, and it's like diet. You tell people they need to exercise, they need to walk or do this, and a certain amount will do it. But if you give them a construct, if you give them a specific construct, you will find that your success rate in getting people to do that will increase. So if we use constructs like, I would like for you to come to a Tai Chi class, or I would like for you to come to a yoga class, that you have increased the likelihood that somebody's going to continue on. And they may branch off from Tai Chi or yoga to walking. But you have to give somebody a bit of a construct and a little bit of accountability if you want them to follow through.
Yeah, I'm a great believer in rewarding and not rewarding. And I believe that families are critically important. So often when a patient comes to see me, if they're married or have a partner, I think it's important that they do things together, because one of the things I always encourage is for people to, if a diet is going to succeed and one person has to diet and the other person doesn't, then the individual who has to diet won't succeed unless, as a couple, they go through and do things together. So you actually have classes where
Absolutely.
you do Tai Chi and yoga?
Absolutely. We have a twice a week Tai Chi class, and we have several yoga classes, and they're very well attended. And you build a camaraderie. There's the esprit de corps. Mm-hmm. You're learning something new, so it kind of stimulates your creativity a little bit and passion for learning. So it all works together, I think, very successfully.
But what about, can you also have access to Zumba classes where you ride bicycles or go to a health club and use weights to build muscle and aerobic exercise? How do you get that done?
Right. You know, this is a very healthy community overall. We have a lot of variety as far as Zumba classes and other exercise classes. A lot of people use personal coaching and things like that. The reason that I use the modalities that I do is because the medical evidence is behind it. There is evidence of how Tai Chi or yoga can help osteoarthritis, how it can help hypertension, how it can help reduce stress, how it can help reduce depression, how it can help with congestive heart failure symptoms. So my reason for getting that is it's a documented exercise program.
So I know you are a family physician, right? So when someone comes to your integrative program, do you become their primary care doctor as well?
No, I don't. I view this as being a supplemental type care that I provide. And I try to provide feedback to other physicians when they refer to me like any other specialist would.
So you're a specialist in integrative care, but you would recommend to a primary care physician that you probably should not use this drug because it's aggravating your patient's pain and making them more fatigued and causing depression. But you work with other doctors to get that done.
Yes, we're attempting to do that. And just like everything else, it's slowly coming around. This is a new venture, I think, for most physicians to consider alternative medical
So
things.
how many patients do you see that are referred by doctors or who come to see you because they want your program?
Oh, the vast majority are self-referral at this point. There are a certain segment of the population, I think, that are kind of predisposed to do things holistically. But what I'm wanting to do is to promote physicians to view me as a resource to do, for them to use for more difficult patients or problems that just don't respond well to typical therapies.
So, like everything else, Baxter Regional is really blessed by having some of the most incredible, innovative, and unique programs in the country. So what about, how do we get in to see you?
Oh, well, I'm very proud that the Baxter Regional Center for Integrative Medicine is the state's first hospital-sponsored integrative medical center, and they can contact us through the hospital. Is the most easy thing to do. You do self-referral. You do not need a referral from your outside physician, and we will get you plugged into the treatment algorithm that we think is most appropriate for you.
Do you have a number that we can put up on the screen?
The number?
We're not sure of the telephone number, but anyway, call Baxter Regional.
Yes.
And get in to see Dr. Bruton and his colleagues. It's not an individual thing, it's a team effort. You have a whole bunch of healthcare providers who work with you, and I think you're onto something.
Well, thank you, sir.
I wish you well.
Thank
Thanks
you
for
very
being
much.
with me.
Okay.
We'll see you next month.